be able to hear what you say. And hold on. And then yeah, she started the recording now. And if you would ask questions in the chat box, we're going to leave time at the end for questions. And oops. I'm going to be putting a questionnaire from the Alabama Council on Developmental Disabilities, which will be in each language. And this is the questionnaire that goes to the federal government that shows what we're doing. So please fill it out. And and we are very thankful, because normally these projects are only funded for 2 years, and they funded us this year as well. So we are very excited. So your feedback has been really helpful. Yeah. Okay, if you haven't already, please click on the link in the chat box and take a quick questionnaire about the content for this. Did you put that in, Maria? You're muted.
It is on the email that it was sent to you.
Oh, okay. I'll do that as soon as I'm done here. And then everything's available in English and Spanish, at least, and some in Korean. Okay. Like I said, we are very excited. We have 3 speakers today. Like I said, the time is going to go really fast. And I'm Doris Hill, and I'm the director of the Regional Autism Network, and I'm an associate research faculty member and one of the PIs on this project. Maria?
Good morning, everybody. Like Dr. Hill mentioned, this is going to be a presentation with lots of information from 2 wonderful organizations that we have in the state of Alabama that we've been wanting to for them to come and present. I am the family navigator for the Regional Autism Network, region number 4. We cover 20 counties, and we are so excited to finally have 2 people from Help Me Grow Alabama and CRS, Children Rehabilitation Services. So please, Miss Mary, would you like to introduce yourself?
Yes.
Buenos días.
Buenos días.
Buenos días, señora Caballero. ¿Podría,
Muy bien,
por favor, ponerse en silencio para que podamos escuchar a los intérpretes y a los presentadores, por favor? Gracias. So if our presenters could introduce themselves.
Would you like me to start sharing my screen, or would you like me to wait?
Could you please introduce yourself, Miss Mary, and then Christine, and then Amy, and then Vonda, and then we'll go back to you.
Okay, perfect. My name is Mary Florian. I am the community liaison for Help Me Grow Alabama. There you go.
Miss Christine?
Hello, I'm Kristen Moore. I am the Care Coordination Program Specialist with Children's Rehabilitation Service.
And good morning, I am Amy Ingram. I am the Audiology Program Specialist at Children's Rehabilitation Service.
Hey, this is Stacy Newman. I think that Vonda's having some computer issues, but they are working to get her on. She's the state parent consultant for CRS and is a mom of a child with special health care needs.
Thank you, Stacy. So for the parents that are attending, like I said, this is going to be 2 hours with lots of information. So get your notebooks and take notes. And we'll begin now. So Miss Mary, now the floor is yours. Thank you, everybody, for being here.
Thank you, Maria. Here we go. Are you able to see the screen?
Yes.
Okay, perfect. Although it's not coming up how it normally does. Sorry. It's doing it differently than normal. So sorry about that. Could you see it large?
We can see it.
Okay. And I'll just go ahead and get started with that and try it this way. So Help Me Grow Alabama is a tool for parents and professionals in early detection and connecting children to resources. It is based on a national model. There are 31 affiliated states across the country. Help Me Grow is funded by the Department of Human Resources. Help Me Grow's mission is to promote the optimal development of young children by linking families to information, providing effective care coordination, and facilitating partnership within the community to improve the accessibility and quality of service for families. Help Me Grow was started by a pediatrician in Connecticut because he saw how many of the children he served falling through the cracks. The Help Me Grow system is built on 4 components: child outreach to child health care providers. So we work very closely with pediatricians. We do community outreach. We have a centralized access point. So anyone calling goes through our office in Montgomery, and then we have care coordinators throughout the state, as well as the last component is data collection. So Help Me Grow is a free care coordination program that works with families from birth to age 8, regardless of insurance, financial need, or language.
I have a question. The slide we're seeing that's the biggest shows blank.
Oh,
Have
Okay.
you tried to share your screen? I mean, share, yeah, where it's not share your screen, but share, you know what I mean, full screen. There we
yes.
go.
Well, let me see, because I had it, I wonder if what is going. There we go. It
There
came
you
up
go.
right this time. It did not
Thank
come up
you.
this way before. Thank you for telling me that. So care coordination is exactly what we do. Once we have a family referred to us, or if they have enrolled, we reach out, listen, and assess the needs. Once that is done, we locate the available services and resources while supporting the child and family needs. The parents make all the decisions. So we let everyone know what is out there. And then, like I said, they get to decide what services they would like to use for their family. Just a little bit lower. There we go. Some examples of care coordination are parenting information, such as potty training, behavioral information, counseling services for families, individuals, or marriage, local speech, occupational therapy, physical therapy, play therapies, employment and housing resources, the ages and stages questionnaire screenings, and I'll go into more of that later. Developmental activities for parents to do with children and discussing developmental milestones, finding daycare as well as childcare and childcare financial assistance, clothing, food, diapers, rent or utility assistance, connection to other assisting agencies such as early intervention, first teacher home visiting program, HIPPY, etc. We also help families through the IEP process for the school system, connection to autism evaluations or other diagnostic assessments, helping find an optometrist, dentist, or other specialist, and connection to support groups or individuals within the local community. Really, our goal is to do anything and everything to lessen the stress of a family, because parenting is never easy. You might have it figured out for one child, and then the next child may have a total different temperament. And so we're here for any questions. So the Ages and Stages Questionnaire is a developmental screening tool used for children 2 months to 5.5 years old. Some people may ask, why screen? And this little diagram will show you. So here we have clearly typical and clearly atypical. But you see in the middle, there's the underdetected. It's those underdetected children that when we screen, we can help and get them the resources that they need in order to develop as usual. So by screening, we are able to catch 20% of the children who are at risk for developmental delays. The components of the Ages and Stages Questionnaire are communication, gross motor, fine motor, problem solving, personal social, and we have a second ASQ, which is the social emotional. And in the state of Alabama right now, all of the children's policy councils have stated that their greatest need is in the in this area, just because with COVID. And so it's really important to look at this aspect as well. So children are continuously growing and changing. So screening is not a one-time event. Children should be screened multiple times before the age of 3. Many programs or pediatricians, well, many programs screen every 4 to 6 months for children under the age of 2, and every 6 months after that. Pediatricians only screen once a month on the yearly well check. And so it's very important to have it in between time. And that's what we're here for. These developmental screenings are normally done by parents. We do provide the screening for all of the first class pre-K throughout the state. Just so that way, if your child is in one of those programs, they are being screened already. So someone asked, when should I contact Help Me Grow? To link a child and their family to resources and support in the community. If a concern arises about a child's development or behavior. For regular developmental screenings, general parenting information, and to discover activities that can be used with children at home. So when we do the Ages and Stages Questionnaire, we also give a sheet of activities for that age range to the parent for them to engage their children for that specific time frame that their child is at the moment. When someone enrolls, parents can enroll, or anyone can enroll or refer. So others that would refer would be childcare providers, physicians, or sometimes we've also seen the daycares. So that's a childcare provider. Once an enrollment is made, the intake specialist will reach out to the family within 7 days. Once that is done, the family will be assigned a regional care coordinator, because we have care coordinators in different locations throughout the state. So that way they will know all of the resources in that area. And they will reach out within 10 days, They will reach out within 10 days. And then if a family is referred, we actually reach out to whoever referred the family within 3 to 4 weeks and say, we've been able to make contact, and these are the resources we've given them, or to let them know, hey, there's been no contact with the family. We've tried calling, emailing, and nothing. Care coordinators maintain regular contact with the family. They make appropriate referrals and provide needed resources until services are no longer necessary. So once a family's needs have been met, we go ahead and close out the family. We ask them, do you need anything else? And if they say no, we close out the family, but let them know that if at any time they need our services again, they can always re-enroll. Or we have families that stay enrolled with us the whole time for the ages and stages questionnaire, for the developmental screening. And so that could be the one need that they have that enables them to stay in the program. So there are a few different ways to enroll on our website, which I will show you here. Let's see if it's going to come up. I think I'm going to have to exit this. So I'll show you the website after. So on our website, you can enroll. We do have the online enrollment form, and we have a toll-free number. With that, if you do not have internet, then we can go ahead and process your enrollment through the toll-free line. But if you do have internet, it's much easier to have the correct information through the online form. There are different ways to contact us. My email is here, but the toll-free line and our website would be the best. So Help Me Grow is just ensuring children and families have the resources needed to help them thrive. And I'm going to share with you a few other resources that we do have to give out to families. We have a pamphlet that has your child's early developmental journey. It's the CDC's milestones, and you can see on this sheet the different age ranges, and so you can check on them yourselves. We also have an app, or the CDC has an app that you can use to track your own child's developmental milestones and to learn more about them. We also have the Handbook for Alabama Parents, and that is a book that has everything and anything a new parent would need to know for their child, whether it be for immunizations, doctors, other resources throughout the state. Let's see. It talks about healthy living as your child grows, toddlers, the first 18 months, dental care, health coverage, feeding your baby, what your baby needs. So it just covers a lot of information, and it has all of the phone numbers and websites for different resources throughout the state. And then I'm going to let you know a little bit more about Alabama Partnership for Children. That is, Help Me Grow is a part of Alabama Partnership for Children. There are 7 nonprofits, and so I'll just highlight the ones I think will be important for you. Alabama Family Central is a one-stop shop that Governor Ivey started so families can research resources for themselves by location. And this would be for education, healthcare, childcare, and family resources. Feed Me Words is a program that you can go online, and it helps teach how to talk to children, or the importance of the brain development within the first 3 years is 80%. And so it's using your words with kids, and it has different activities you can do with them and books to read to them. Sorry, it went away. Let me go back. Here we go. Strengthening Families is a program that focuses on the protective factors within the family, but it also gives a support system to parents. They, throughout the state, have local like coffee shop type meetings. And so it just gives parents a chance to be able to get together and talk and have stability. Yeah. And then I'll just tell you all, Healthy Kids, Healthy Future is a program that goes into licensed daycares and helps with the nutrition program within those daycares. First 5 Alabama is a licensed daycare program that mental health consultants go in and support both the teacher and the parent if a child is having behavior problems. And Teach is a program that for anyone who is working in daycare and wants to further their education, they will help, they'll give scholarships for those to get their education degree and to stay in that field. So let me get out of this and I will show you our website so you know how to navigate it. Let me go to the home. Okay, so if you come to our website, this is what you will see at first. You'll see that they have a place for families, providers, and developmental screening. Say for the families, you can go here. It talks about your child's development. You can see other information. So just showing you that they have the information there. And then if you go to enroll today up at top, you would put, I'm a parent and caregiver who want to enroll. And then you would just fill out this form. It comes to us. And then, like I said, within 7 to 10 days, we would reach out to you just to confirm all of that information, find a little bit more about the needs that you have or questions you might have, and then get you linked to the care coordinator within your own region. Okay, let me get this. Stop sharing. That way I can see what's in the chat.
Mary, I send you all the questions that have been coming.
Okay, great. I couldn't see it while I was doing the other part, so I'll go ahead and go through. Does a child needs have to be any kind of insurance to screen? That you don't have to.
So Mary, if you could read the question maybe out loud, that way if somebody is thinking about that, then people know already.
Okay,
Thank you.
we'll do. Does the child needs to have any kind of insurance to be screened? So no, you don't have to have any insurance, and it does not matter what type of insurance. This is a free program that we offer everyone throughout the state. So for us, it does not matter. It might for your pediatrician. So we can do any insurance, but we don't even file anything with your insurance. The only reason we ask that question in the enrollment form is when we are trying to help link you to doctors, because we want to make sure that they will accept your insurance before we refer anyone to them. So we don't do anything with your insurance. Can children born out of the US be part of that program? Yes. This program is for anyone. It does not matter your citizenship. We're just here for everyone in Alabama. And then if you know other people in other states, you can let them know that they're to look up to see if in their area they have a Help Me Grow. Because like I said, it is throughout the whole state, United States. Until what age should children be screened as part of your program? We go until 5.5 for the screening. That is when the ages and stages questionnaire stops. If it went higher, then we would screen, but we can't. We do help families up until the age 8 though. So the screening ends at 5.5, but if families need help until 8, we continue. Once the child is screened by your organization and a care coordinator helps with additional services and referrals, like helping with IEP or attending along with the parent. I'm not sure what the question is there. Hold on. Yes, we do. I'm not sure if I'm answering the question, but I'll just go ahead and state what we do. And then if there is a further question, feel free to follow up with it for whoever had put that in there. So yes, once a child is screened, we assess the screenings, we go over them with the parents. And if there are any flags or areas that we see that the child needs a little bit more help in, we will actually give activities to the parents to work with the child in that area. And then within, depending on their age, we will rescreen within 4 months or 6 months, depending, or 3 months to 4 months, and then see where they're at. And if there's no longer a need, like if they've been able to develop with the parent working with the child, there's no need to refer out. But if there's still concern, then we go ahead and refer and get them linked to the resources that are needed. Once that is done, then we link them, the question was to IEP or attending along with the parents. We do not go with the parents to the IEP. Our one form of like our communication with the families are through phone, email, and text. So we do not go out into the homes. All of our communication is based on what you say you want with us. And so we respect that. If you say, hey, check with us in 3 or 4 months to see how we're doing, we'll follow up, see what's going on, see if you have been connected to the resources. And then you can always text, call, or email your care coordinator as well as you see needed. If we're not reaching out to you and you have a need come up in the meantime, you can always contact us. Do you have staff that is bilingual for Spanish? We do have one person. She is our intake specialist. So anyone enrolling in the program will be able to speak with her first. She will try and gather as much information as possible. So that way she can pass it along to the care coordinators. She is a new addition to our staff. When I was a care coordinator, I would often have to use Google Translate and text families that way and going back and forth. We also do use the translation line, but sometimes it did not work well depending on the family or even the interpreter that we would get once we call the interpreter line. But we do have one now. Are those resources available in other languages? We do have them in Spanish. We do not have them in Korean. For the ages and stages questionnaire, we do not have that in Korean, but if any Korean family would like to fill it out in English, they're more than welcome to, or if they need someone to help translate with them to sit down and fill it out, we encourage that as well. It's just the program, they just don't make one in that language at this moment. After a child has the evaluation, do parents receive anything we can share with the pediatrician? Yes. So once a family enrolls in our program, we ask them, do you want us to keep your pediatrician informed? If the family says yes, once we do this evaluation, the screening, we actually send it to the pediatrician so he has it, but we can also send it to you so you have something in hand to take to the pediatrician, because sometimes I've encountered parents have concerns and the pediatricians are not listening to them. And so with having someone else do this screening and the parent being prepared when they go in and saying, hey, look, this is what this is showing for my child. Something needs to be done. It does help. I never knew about those programs. Did pediatricians know about them? So I go to the pediatrician conferences throughout the state. I try and work closely with pediatricians. It's very hard to get into certain offices because office managers have a wall up to where you can't get in unless you have an in. I go and do outreach. I drop off folders. I try and let them know, because we work with pediatricians in a very specific way, to where if a pediatrician refers a family to early intervention or speech therapy, we give them the option to refer them to Help Me Grow at the same time. And we will follow up to make sure that family is receiving those resources. And if not, we will advocate for the family and figure out where they need to go. And then let the pediatrician know what the family has been linked to. So it helps the pediatrician and their staff tremendously. But as I said, it's very hard to get in with some of them. We work very closely with some, and there's others that I just have not been able to get into. So feel free to share our information with your pediatricians. Can you have access if the child is not a US citizen? Yes. I wish I knew about this program years ago. My child is now 12. Is there anything you can help? This program is not as well known as I would like. I used to be a principal in Tuskegee, and I wish I had known about this program when I was out there, because it could have easily helped my preschool kids, kindergarten kids, all the way up to second grade, and the families, but I just did not know about it. And so you're correct. And there's turnover in so many different community agencies, that constant outreach is needed in order to get this out to the families of those that they serve, and to those who are getting to those other community agencies. As far as this child is now 12, There's not anything that we normally do. We would not enroll a child. We can't, for our grant status, enroll anyone above 12. I mean, above 8. A lot of times if that happens, like if a family says, hey, we have a child that's 12 and we need some help, I would say, hey, do you have a younger child? Enroll that child. And once a family's enrolled, we actually look at the whole family and assist. So that way, if mom's looking for a job, we'll help them find a job. If they're needing other things, or if they didn't finish high school and trying to get linked to getting their GED, like we'll cover the whole family once they are enrolled with us. You said something about childcare. Can childcare provider refer a child to be screened? Yes. We work very closely with licensed daycare centers and home providers. And so a lot of them are actually, well, not some of them are using our ASQ, but if they are not, they can go online and refer the family or the child as well. How do you assist in helping with IEP? A lot of times families do not know how to navigate through the IEP process or even where to begin with the school. So it's getting them linked to those resources, getting them to the correct individuals. With each family, it's different. So I wouldn't be able to tell you exactly. It just depends on that family's needs. I meant, oh, if the care coordinator could attend in an IEP with the parent as a support person. No, we do not do anything in person. As I said before, our one communication is through phone, email, or text. So we would not be able to go as a support. If that is something that you would like, and your child is of the appropriate age, we could try and get you to one of the other programs that actually goes into the home, and that person could possibly assist you, but we would not be there. What age can you receive CRS services? Isn't she next for the CRS services? Okay, so I'll leave that question for her. Is the book of resources you mentioned only offered to a parent enrolled in the program, or is it offered to the public? We give them out to anyone and everyone. So if you would like one, we can figure out how to get it to you if you contact us. A lot of times I bring them to pregnancy centers because that's where parents are located. And we also partner with Jackson Hospital here in Montgomery, and they make parent kits for new parents with that book included. There's, I think, also a hospital down in Fairhope that does the same thing. It just depends on who knows about our program and high enough, I guess, in the hospital that wants to partner with us. Some disabilities appear on the website. What should parents do when these are not on the list and they are new? For example, central auditory processing disorder, visual and hearing impairments. You can still enroll and let us know what your needs are. I'm not exactly sure what the question is there. There's probably just some examples that are on the website, but it will never include everything that a family needs just because there's so much. I don't know what this one says in English. I mean, in Spanish. Do you see the one from Guadalupe? Okay, thank you. Are there similar programs in Alabama which help tracking on the development of children? If so, can you share the links? The one that I know about would be the CDC milestone tracker. And that is in the PowerPoint. So you can always go back and look at that because you'll have the PowerPoint to see. How long does the enrollment process take? So between 7 and 10 days, you will hear from our intake specialist. And after that, you'll hear from our care coordinator. Probably, we try and make it quicker, but we always give a week leeway. So I'd say about 2 weeks, just in case there's a lot more enrollment at one time than another. We try and, you might hear from us sooner, you might not. So, and that is all of the questions that I have in here at the moment. I'll just wait for that one to be translated. Oh, here it is. I enrolled 2 years ago, got assigned a care coordinator. She sent me some messages, and the last one she mentioned she would look for some resources for me, but I never heard from her. I called many times to ask, but I have not heard from her. Can I ask who the care coordinator is, what her name is?
If probably they could send it to you privately. So for the parent that is asking that question, can you send in a private mode to Miss Mary? Thank you.
I'll just let you know, we have had in different areas some turnover with care coordinators. During COVID, we did use our Google Voice numbers. And so if you're using a Google Voice number, that could possibly be the reason no one's calling you back, because if they're gone, we don't have that number. And so if I'd say call our toll-free number. I'll go ahead and I'll put that in the one for everyone. And then with that, you can talk to someone directly. And then we can get you assistance.
Mary, to the best of your knowledge, are there any similar programs like these ones for the younger population, but for older kids in the state of Alabama?
Not at the moment. I wish there was. In Texas, there is a program that they called Help Me Thrive, and it's a continuation of Help Me Grow all the way through 19 or 21. I'd love to see that here in Alabama, but it's not here yet.
I do not see any other questions.
I'm answering one privately. How do I? Okay.
Can you share on the chat box what is the name of the program in Texas?
Yes. Let me see, and to everyone. Like I said, we don't have anything here, but I'd love to, if there's a way to get that to Alabama, it would be so helpful for parents because, I mean, you still have questions and needs after age 8. I'm just grateful that we can be that safety net, especially for children once they age out of early intervention and before school, because that age gap, there's so many kids that get lost in the system.
I agree. I do not see any other questions, but I would like to tell our attendees, parents and professionals, I see that we have a lot of professionals attending, that if you have any other questions that are more personal, please send, regarding your loved one, feel welcome to email Miss Mary. She will connect you with the people that you need to speak with, or give us a call. I will send the copy of the PowerPoint that has been translated into English and Spanish to all attendees. Feel welcome to share them with other professionals, for the professionals that are attending. And also, Dr. Hill, I was thinking if you could please add the chat, add the links for the evaluation, since we have 2 organizations presenting. So this one is
Okay, I'll put them in again.
Thank you. So
There is one more question. Sorry. It asks, is the whole service only before 8 years old or only limited for assessment? No, we care for the whole family up to age 8. The ages and stages questionnaire goes to 5.5. So if there's any needs that the family might have resource-wise for the family up until age 8, we will assist them. And that is all. Maria and Dr. Hill, thank you so much for having us on and being able to share our resources with all of those that you serve. It's greatly appreciated.
thank you, Mary. Again, I mean, I know that this is a well of information, and I myself didn't even know about some of the programs that are under the bigger umbrella. So it's a great way for us to be connected. And what I really think that Help Me Grow makes a huge impact is that after the children have been screened, there's that connection with other entities and other agencies, and how, parents get copy of these reports so they could share them with professionals and pediatricians and school. So that is very helpful. So thank you, Mary, for presenting and for all that information. And we'll be happy to give you feedback from our attendees.
Great, thank you.
Yes, thank you. That was very good.
And have a wonderful day. Thank you,
Thank you.
Mary, again.
I'm answering one, so I'll stay on just for a moment and then.
Please do. Yes. So now we'll transition to our second speaker. We have 3 speakers from one organization, Children Rehabilitation Services, but Dr. Hill has posted the surveys. Please, we invite you to complete these surveys for both presentations, because you're learning about the resources from 2 different entities. So we want our grantees to know that we have presented and shared that information, and now you have this valuable information that will help you make decisions for your loved one in the future. So please take a moment to fill them out. You could click on the links. We have them in English, Spanish, and Korean. But thank you for our next presenters, Ms. Vonda Reeves, Ms. Amy Ingram, and Christy Moore. They are from Children Rehabilitation Services, and this is an agency that provides services for families. And many times, our families are confused about what is the purpose, what can CRS do for our families, and what kind of services they provide. So, Ms. Vonda, I don't know.
You are not ready. When you be ready.
I don't know who you would like to begin with, but you are, the floor is yours.
Good morning, everyone. Thank you, Maria and Dr. Hill, for the invitation. And Ms. Mary, your presentation was very good. Thank you for that information. I'm going to turn it over to Kristen Moore, who's our care coordination specialist here in the state office, and she's going to start us off. So again, thank you for the invitation.
Good morning again. I am Kristen Moore. I am the Care Coordination Program Specialist. And I am actually going to go ahead and try and share my screen so you guys can see the PowerPoint. Let's see. Okay. See, nope, let's not do that. Oh, well, hang on a minute. I didn't. Do y'all see the PowerPoint? Okay, let me see if I can. Did it go to the big screen where y'all can see it? All right, fabulous. Okay. So we are Children's Rehabilitation Services. We are a statewide program that provides medical and rehabilitation services to children and youth with special health care needs. So we have offices throughout the state where individuals can come and present for enrollment. And if you have a qualifying diagnosis for our services, we are able to provide those services to you. We have a myriad of medical and evaluation clinic services that are able to be provided, and they take a multidisciplinary team approach in a lot of those different clinic settings. And we will show you a few of those different ones in just a moment. So our team consists of different physicians with different specialties. We have social workers and nurses who provide care coordination services along with services in the clinic setting. Audiologist, speech and language pathologist, physical therapist, dietitians, occupational therapist, parent consultants, youth consultants, vocational evaluators, and support staff. You'll notice that the different therapists that are listed here, it is important to note that we do not provide direct therapy services to families. These disciplines are in place to provide services through those evaluation clinics. And if those private therapies are warranted after that evaluation, then referrals are made out of those clinics in order to help establish the family and the client with those professionals. Social workers and nurses, like I said, provide those care coordination activities. And that is a list of different things. One thing that I heard you guys asking from the previous presentation was, can those care coordinators go into the schools to assist with IEP support? And the answer for them was no. But for CRS care coordinators, they can go into the schools with the enrolled families in order to provide that support in the IEP setting. Physicians, we have a myriad of different specialty physicians just based off of the different clinics that are that the children would be attending. So they range anywhere from neurologists, orthopedic physicians. We have clinics that are specific to cystic fibrosis. We have, so there's those pulmonologists that are located in there. We have rehabilitative medicine clinics. And so those specialty physicians are part of our network as well. The vocational evaluators, those are more for our transition age youth. So we serve clients between the ages of birth and 21 years old. So you can come enroll as soon as you recognize that there may be a need for our services. And you can make that referral yourself. We take referrals from parents, we take referrals from physicians, we take referrals from schools. If there is a potential need in the child or the youth, that referral can be made from whoever sees that need. Once the referral is received, the care coordination staff will then contact the family. So if you are not the family who's making the referral, if you're a physician's office or if you're a school or an outside entity, when you make that referral, we do need contact information for those families in order to make contact with them to determine eligibility for our services. You do have to be a resident of Alabama, and per state and federal regulations, you do have to be a citizen of the United States in order to receive services through Children's Rehabilitation Services. But again, those services are provided from the ages of birth till the 21st birthday. Once the youth turns 21 years old, we can no longer provide any of those services unless that individual has a diagnosis of hemophilia, and then they can be served through adulthood as well. So I mentioned on the previous slide, vocational evaluators working more with our transition population. That plays into some of the clinics that we have based around transition of youth with special healthcare needs, and those vocational evaluators come into play there to provide evaluation services to determine a pathway that an individual may be able to take to increase independence post high school, whether that's through the workforce, whether that's through a post-secondary education, or whether that's increasing independence as much as able within the home. So we have a list here of examples of special healthcare needs. This list is not exhaustive. This is a list that shows the most common diagnoses that we see through the kiddos that we enroll. So communication disorders. I know children and youth with a diagnosis of autism oftentimes have a communication disorder, whether that is expressive language delay, receptive language delay, or mixed receptive expressive language delay. We can evaluate for not to diagnose that disorder, but we have an evaluation clinic that can look at that area to determine if augmentative communication, whether that be through picture symbols or a communication device, would be an appropriate intervention to increase the independence of the child or the youth. So we serve kiddos with hearing loss, and we have hearing assessment clinics that address those needs. We serve children and youth with feeding difficulties. So your children who are diagnosed with autism and other diagnoses sometimes struggle with feeding, whether that be because of different textures that they're not, fond of, or, shapes, specific colors of different foods, and just the diet, they're struggling to be fully nourished through what they are taking in. We also address concerns when it comes to swallowing and making sure that individuals who are eating have that safe swallow. And if they are, receiving therapies to address that, we can work alongside those private therapists to come together as a team to help support those individuals. So we serve children with a diagnosis of cerebral palsy, seizures, spina bifida, cleft lip, and cleft palate. We have individuals birth to 21 with traumatic brain injuries, spinal cord injuries, scoliosis, cystic fibrosis, limb deficiency, orthopedic concerns, and as I mentioned before, hemophilia as well. So while autism is not a service that we are able to bill, while autism is a diagnosis that we are able to bill directly, we can bill for conditions that are related to autism, like your communication disorders and your feeding difficulties that a lot of those children and youth may experience. If you don't have those diagnoses, those communication disorders or those feeding difficulties diagnosis, you can still be enrolled for services based under the diagnosis of autism alone, but it is not a billable diagnosis, and you cannot attend clinic with that diagnosis alone. You have to have a different, a paired diagnosis like those communication disorders or feeding difficulties in order to attend those qualifying clinics. So I'm going to let Amy pick up with the different services.
Good morning again. I am Amy Ingram, and I am the audiology program specialist for Children's Rehabilitation Service. My background is in audiology, specifically pediatric audiology. An audiologist is a hearing healthcare provider. So I've spent many years working with kids, specifically for CRS birth to 21 that have been diagnosed with hearing loss, whether it be permanent or temporary. But so in CRS, what we do is we have several different types of clinics. One of those is a clinical medical model, and that is where we have physician-led clinics. So again, kids that are coming through an orthopedic clinic, it is led by an orthopedic physician, and those clinics are really important because they really pull in our full team. We're lucky that we have a great team approach, which includes the physician, a nurse, a care coordinator. Anybody that is involved in those specific clinics will be in those clinics to meet the needs of the family. We also have evaluation clinics, and those are also a multidisciplinary clinic. An example of this type of clinic would be a hearing assessment clinic. So if your child is having hearing difficulties, they would be seen in our hearing assessment clinic. Another example would be feeding clinic. Some of those clinics, that are not led by a physician, but more our disciplinary staff, such as the audiologist, the speech therapist, dietitians, physical therapists. One of our big parts of our program is care coordination, and our care coordinators are social workers and nurses, and they provide family support and connection with available resources and community aids. So anything that the family needs at that time, that care coordinator will help them find some resources available. Also information and referral. So we provide education about available resources, and that usually comes through, it can come through any of us, the care coordinator, the audiologist that is seeing the patient. We also have parent connection. So staff members provide parent-to-parent support to families. Vonda Reeves is our state parent consultant, and she has worked very hard to make sure that we have parent consultants in all of our districts. So families that are clients that come to our clinics and the families that accompany them, we hope that they will be able to see a parent consultant at the time just to provide parent-to-parent support for those families. We also have a youth consultant, and they provide peer-to-peer support. So it's always nice for some of our clients to have a fellow youth that is experiencing some of the life struggles that maybe some of our kids experience that have certain disabilities, and so they're able to provide peer-to-peer support. Just an example of some of our medical clinics, again, neurology, orthopedic, hemophilia, neuromotor, cleft palate, craniofacial, seizure. We have a newborn follow-up clinic, genetics clinic, eye clinic, limb deficiency, amputee, neurosurgery, scoliosis, cystic fibrosis, and spina bifida. An example of our evaluation clinics, again, our ACT clinic is our augmentative communication technology. So for those clients that are having communication difficulties, whether it be an expressive communication disorder or a receptive, like some of our kids that have been diagnosed with autism, they can come through this clinic and be evaluated for a type of communication device, whether that be a picture board or an actual device that can be used. Again, feeding clinic is led by our dietitian. So clients that have feeding difficulties, whether it be a texture issue, not gaining enough weight, can be evaluated through that clinic. My specialty is hearing assessment and hearing aid clinics. So we receive a lot of referrals to our hearing assessment clinic. For example, speech delay. With COVID, we've had a lot of referrals for speech delay. Those babies that fail their newborn hearing screening in the hospital at birth come through our hearing assessment clinic. And any kid that's been diagnosed with a hearing loss will come through if a family chooses hearing aids as a treatment option. They can come through our hearing aid clinic, and we do provide for families that qualify for purchase services. We do purchase hearing aids and ear molds, anything associated with the hearing aid. We do provide that in that clinic. We also have seating and positioning clinic that's led by our physical therapist, speech pathology clinic, and then a really great clinic, teen transition clinic. And as Kristen mentioned earlier, we hope that our clients that come through CRS, we only provide services through 21 years of age. And so we really hope that those kids come through our teen transition clinic. It's a really great clinic that pulls in people from our vocational rehab side, so our adult side of our program. They talk about the client's goals. Do they want to go to college? Do they want to become a nurse? What do they see for themselves in the future in that clinic? We have several of those clinics throughout the state. 2022 was a big year for us. We served 13,777 children and youth with special health care needs, including 296 with no insurance through the clinic program. We also served 433 adults and children with hemophilia. We assisted over 1,800 clients with connecting to community resources totaling almost $1.5 million. We expedited Medicaid net travel reimbursement for an estimated total of $138,000. And we also provided information and referral sources to over 3,000 consumers. Looking ahead for CRS, we have introduced a pilot clinic, and it is our Autism Diagnostic Evaluation Clinic. The goal of this clinic is obviously early diagnosis. We know that there are pretty hefty waiting lists throughout the state of Alabama for children to be evaluated for autism. For this clinic specifically, the referrals are received through early intervention. So the child has to be enrolled in early intervention to come through this autism diagnostic evaluation clinic. They have to be between 18 and 36 months of age. This is an evaluation clinic, so it is going to be a clinic that's led by a developmental pediatrician and also a multidisciplinary team. The children are being seen by a speech therapist. They're being seen by an audiologist, our nurse, social worker, again, a team approach for this clinic. The first pilot location was in Tuscaloosa, and then our next location for this clinic is going to be our Homewood office. So again, this is just a pilot clinic right now. It is really, they've had really great results out of our Tuscaloosa office, and we are hoping to bring it to more CRS offices throughout the state. Right now, though, it is only in Tuscaloosa and Homewood. One thing that we did leave off on our future is we are working on a mobile unit, and we hope to provide services to our CRS clients through our mobile unit. That's going to be a couple years away, but we are working on that to provide services in our rural areas. This is our CRS locations, and each district, for example, our Andalusia office covers counties for Butler, Conecuh, Covington, Crenshaw. I know for Lee County, that's covered under our Opelika office. So it covers Chambers, Lee, Macon, Randolph, Russell, and Tallapoosa. It's got the address and the 800 number to contact if you are interested in our services or seeing if you qualify for our services. We also have a website. It is at the bottom of this screen. If you can see it, it's at rehab.alabama.gov. And once you go to that website, there's going to be a place for you to click on programs, and you'll want to go through Children's Rehabilitation Service. And then it will also provide this same location and contact information screen if you're interested in our services. And Maria, that is all we have for CRS, unless Vonda or Stacy Newman has anything that they want to add.
I actually,
I-
oh, go ahead, Vonda.
Thank you, Kristen and Amy. I've been sending the questions to Ms. Vonda. They've been coming, and this is great information. And I think that a lot of the questions the parents are asking, maybe some of them were already responded, but Ms. Vonda, if you want to read them out loud and then see who wants to address the question, or if there's anything else that you want to add.
Yeah, okay. I'm going to talk very briefly about the parent consultant portion of CRS, and also our youth consultant, Courtney Adams, is also on with us today. So the parent consultants, we have 12 local PCs in each office. Actually, we have 10 positions filled. We have 2 vacant. One is in Muscle Shoals and the other is in Montgomery. And we're hoping to fill those positions. We're looking for a dad or someone who's bilingual who would love to be a support to families within our local offices. And the parent consultants, we work very closely with the care coordinators as well as the specialists to help with providing resources to families. They're there to help guide CRS policies, and also to make sure that whatever resources they're in the community, that they'll be the bridge between helping them find those resources and the bridge between the staff as well as the families. And Courtney Adams, she's on. Courtney, we have something you would like to share about what you do. We also have a parent advisory committee. So even if they're not enrolled in CRS, we want to encourage them to also visit a local CRS office so they can be a part of our group. They get information such as you're providing today with Maria. So Ms. Courtney, you have anything you'd like to add?
Hey y'all, as Wanda said, my name is Courtney Adams. I'm the youth consultant down here in Dothan, obviously Alabama, in Dothan. I'd like to share a little bit about the YAC committee, and it's the Youth Advisory Committee. And I'm just going to read a few things to you. It's basically saying that we provide a platform to inform children, to inform CRS and its partners of concern faced with special health care needs. Like I forgot to mention, I have a special need. I have spina bifida, so I am a wheelchair user, and I share my stories and my way of going through CRS, as I have my whole life since I was 3. I share about my story, how I drive, college, and all that. And it's just a group to get together with kids with all special health care needs. So that way we can get together and we can become all friends.
Thank you, Courtney. Stacy, you have anything you'd like to share? Stacy Newman.
Well, I would just like to promote, in partnership with Family Voices of Alabama, I don't know if you all have heard, but we are holding our annual Partners in Care Summit. We are back in person in Prattville. It's April the 17th and April the 18th. I can put the link for more information in the chat. And April 17th is our first day for parents and families only, and there are going to be some exciting activities. I know the presenters, and it's going to be a fun, interactive time for parents and families to share. And then on April 18th, it is the day where the families and providers come together. We're going to be sharing information on the Maternal and Child Health Bureau's Blueprint for Change, which is the model that they have recommended for healthcare services for children and youth with special healthcare needs. We'll have a national speaker on the panel, and it'll just be a lot of great information shared. So we love to have any and all of you all join us. And again, I'll put the registration information in the chat. Thank you, Wanda and Maria.
Thank you, Stacy. And the parent consultants we work very closely with, Family Voices, so you'll always see us working in collaboration together. Family Voices have a lot of great resources that the parent consultants also provide to families. So I'm going to ask here some questions. What kind of diagnosis qualified for your services, for CRS services?
So we have a list of a very long list of qualifying diagnoses. I would suggest that if you have a question about whether or not your child qualifies for CRS services, if you will, once the presentation is sent out to you guys, we'll make sure that the clinic or the office location slide is included with that. I would encourage you to contact that specific office and speak with an intake worker, and they can gather information from you based off of your kiddo's needs and the concerns that you have, and determine if enrollment is appropriate. If there is not a diagnosis available, then they can enroll under what we call a deferred code, and the care coordinator can then work with the local physician office to determine eligibility for any services that CRS may be able to provide the child.
Okay, next question. CRS is a referral clinic like a pediatrician?
No, we are not primary care. So we work closely with those primary care offices such as pediatricians in order to obtain referrals like Medicaid referrals or private insurance referrals in order to evaluate the child in the various clinics that we have, but we do not provide primary care services. We don't even house physicians in our local offices. They are community physicians within the community that come and provide those services for us.
If your child was not born in the U.S. and has Blue Cross and Blue Shield, already has a pediatrician, can I still request a referral for CRS?
So as long as the child is a citizen of the United States, we can and a resident of Alabama, we can provide those services as long as that qualifying diagnosis exists. It does not have to be a physician referral. If the parent notices concerns or needs with their child and thinks that CRS may be appropriate, again, I would just encourage that parent to call the local office and speak with one of those care coordination intake workers to determine whether or not the services that CRS has available would be of benefit to the child and the family.
If a child has an emergency Medicaid, can he receive services through CRS?
So emergency Medicaid, we do bill full Medicaid and for services, but emergency Medicaid typically only covers those emergency type situations, and so we are unable to bill that. Again, as long as the child is a citizen of the United States, we can potentially work with the family to help them obtain that full Medicaid status as long as they meet those income requirements as set forth by Alabama Medicaid.
Maria, there's one in Spanish from Neely. So the next question is, can school request an AT assessment and contract with CRS to evaluate the student? And can CRS provide an assistive technology communication device if recommended by speech pathologists from the school?
So Vonda, you cut out a little bit at the beginning of that. I think I got the gist of it, but I just want to make sure.
Okay, can your school request an assistive technology assessment and contract with CRS to evaluate the student?
So no, in short, no. So your school systems have that assistive technology evaluation system that's in place. Our augmentative communication technology clinic is put into place to evaluate those kids with those expressive, receptive, mixed expressive, receptive language disorders. We can work very closely with the school systems once the child comes through that evaluation to determine whatever method of communication would be most appropriate for the child. A school can make that referral with those, if they have concerns about those language diagnoses and disorders, but it would not take the place of the assistive technology evaluation that would be required if set forth in the IEP. The school would still be responsible for that.
Can CRS provide an assistive technology communication device if recommended by the speech pathologist from the school?
Not based on that alone. We do, if we bring a child through our augmentative communication technology clinic, we do our speech, that is a clinic that is led by our speech and language pathologist. And so we do like to get releases of information on file so that our speech and language pathologist can communicate with the speech and language pathologist who is seeing the child within the school system. And we love to collaborate, you know, once that child has come through our clinic. If a device has been recommended, we want to make sure that anybody who is interacting with that child, whether in the home or in the school, that they are comfortable helping the child to access the device and become more independent with the device. But alone, we cannot go off of the recommendation of the school speech and language pathologist alone. The school speech and language pathologist can certainly make a referral to CRS, and the care coordination staff can contact the family and gather all of the medical documentation that's needed to determine eligibility for that clinic. And then once that kiddo is seen in that clinic, that evaluation will determine whether or what level of communication, augmentative communication, is most appropriate for the child.
And I would like to say something real quick, Wanda. In regards to that question, our speech therapists, I know, have worked really hard to work really well with our local school systems to establish that relationship. And so usually there is like the speech therapists in the schools are making those referrals to CRS. Usually if they know that client is going to qualify for services through our clinic. So we do have our speech therapists usually have a really good relationship with the school speech therapist as well.
And if the whoever posted that question, if you would like the name of the speech and language pathologist for the office in your area, I'd be more than happy to provide that contact information, because again, we love to collaborate. You know, kiddos spend a lot of time in the school system, so we want to make sure that they're equipped.
Okay. Can you clarify about the communication disorders and how that will qualify individuals who also have autism diagnosis?
So the communication disorders that I mentioned that are able to be billed, because we do bill insurance for the clinic services that we provide. We do not charge families for any of our services, but we do bill the insurances that they have for the reimbursement through those providers. So the billable codes that we have for language disorders, the ones that we are able to bill are expressive communication disorder, which means that a child has trouble communicating verbally. Your child, if you have an expressive language disorder, you may communicate through pointing or vocalizations, but maybe not have any words that are part of those vocalizations. You may look at specific items to indicate that you want or desire something. You may bring a person to said object to communicate that that's something that you're desiring. You may sit and cry because you can't get that message across any other way. So those are examples of expressive. Receptive would mean that you have trouble receiving what is being communicated to you. And so then mixed receptive expressive would be a combination of those two examples. And those are the codes that we are able to bill through that augmentative communication clinic to evaluate for the need for an augmentative communication system. And I say augmentative communication system because not every child that comes through that clinic is going to leave with a high-end device. You may come through that clinic and leave with a picture board of different pictures that have core vocabulary words on them, or words such as go and stop. And the speech and language pathologist will then work with the family to educate them on how you implement that within the home and within the community. One example would be like if the child is struggling with verbal communication, putting your picture symbol of go next to your door, like your door that leads outside. And then when it's time to go outside, you touch go, you say go, and then you exit through the door so that it communicates to the child, oh, go means we go through that door. And so that would be an example of something that would be no technology at all, but an augmentative communication system.
Okay. My child is hearing impaired and uses a cochlear implant, and it was recommended the teacher use a microphone, but my child said it has not been followed. Can the coordinator help me sort this out with the school? My child is a consumer of CRS.
Yes, and so I would like to speak on the cochlear implant area. As of right now, we do not have a cochlear implant clinic, so we are not servicing the actual implant, the processor. We are not doing any mapping for cochlear implants. However, because a child has a diagnosis of hearing loss, we can see them through our clinics and for care coordination purposes. I would have usually the managing audiologist, so I'm assuming since this client has cochlear implants, they have a cochlear implant audiologist. I would recommend reaching out to the cochlear implant audiologist first. And if you don't get any help there, then the local CRS audiologist should be able to help put you in touch with somebody to help get that microphone situation fixed at school, because that is very important, and that is something that the implant user is going to have in the classroom to hear. So we need to get that fixed quickly. You can also, if the child has an IEP, you could always go to the IEP coordinator to let them know that the microphone isn't working, because if that's listed in the IEP as something that is needed for communication, then that should be fixed very quickly by the school system.
And so if whoever posted that question is uncertain of who their care coordinator is, if you would like to message me, I can provide that information to you as well. I would just need the child's name.
Do you see clients who have an auditory process disorder as well?
So central auditory processing disorder is not a qualifying diagnosis through CRS. Unfortunately, we do get a lot of referrals for auditory processing disorder, but we are, again, that's not a qualifying diagnosis for our services.
If a parent decides to self-pay and medical insurance Blue Cross Blue Shield, can they access services on CRS? What about direct pay?
So I'm sorry, can you repeat that question, Vonda? I missed part of it.
If parents decide to self-pay and medical insurance Blue Cross Blue Shield, can they access services on CRS? What about direct pay?
So I'm understanding that question to mean, can families pay CRS directly for the services that we provide? No, because we don't charge families. We bill insurances. So if that insurance is in place, then we would have to bill that insurance. If the family does not have insurance and is a resident of Alabama and a citizen of the United States, they can enroll for services, but the care coordinator would then be responsible for working with the family to establish insurance coverage, whether that be through Medicaid, Alabama Medicaid, all kids, or through the marketplace system. But if that insurance is in place, we have to file the insurance that is assigned to the child.
Okay. If you're interested in a child participating in teen transition clinic, does a parent talk to the child's school about enrolling them, or does a parent call CRS directly?
Call CRS directly. If the child is or the youth is already enrolled in Children's Rehabilitation Service, contacting your assigned care coordinator would be the first place to start. Contact that care coordinator and let them know that you heard about Teen Transition Clinic and you would like to discuss what those services are and your child's eligibility for that clinic. If you are not enrolled for Teen Transition Clinic services, you can enroll just to attend that clinic as long as you have that qualifying diagnosis. And then when you present for enrollment, you would let the enrollment worker know that that's why you're seeking out services. And then conversation would be had between the parent, caregiver, and youth at that time to determine if there are any other services that CRS can provide.
Okay. So, Ms. Karen, I'm assuming that this question is about the vacancies for the parent consultant positions. Your question is, where can we find a list of job postings for your agency? So if you're inquiring about the parent consultant's position, I can make sure I send a flyer to Ms. Maria, and she can send it out to you. And we would love to have you apply for the parent consultant position. Now, if you're asking about the merit positions, then you have to go through the State of Alabama Personnel Department for that. Kristen,
Well, we do have, sorry, Vonda, go ahead.
No, do you have anything else you want to add to that?
I was going to say, if it's any professional positions such as social workers or dietitians, we do have some openings for those positions throughout the state, as well as a administrative specialist. So if there's any professionals, or if you're asking for a professional position, you can email any of us, myself, Kristen, Vonda, or Stacy, and we'd be happy to give you some additional information on that, because unfortunately, it's not necessarily specific to CRS when you go to the state personnel website.
Although your social workers do say children's rehabilitation social worker. So that is notated on the job classification.
Okay. So the next question, do you have a bilingual staff in your offices? No, and then yes. In some offices there are some people who are bilingual, but as a whole, no. But we do have a language line that we use to communicate with our families.
We also contract with interpreters. So we do have interpreters who are able to attend our clinics to provide interpretation in the clinic setting. If you have called your care coordinator, or if you're calling an intake worker, or vice versa, and interpretation is needed, we can utilize the language link. That is also what's primarily used when you come in for an enrollment, is the language link, because we don't always know, because our enrollments are not appointment based. You can present for an enrollment at whatever time works best for your schedule within the office that is going to be providing you those services. So with that, it's hard to have those interpreters present for those appointments. If you have someone that you can bring with you, that's always welcome as well.
Yes, you may have a copy of our PowerPoint presentation. So Maria should have that, and she'll send that out. What do parent consultants do? Okay. We do, we really provide more peer-to-peer support, parent-to-parent support to families. If they receive a diagnosis for their child, let's say spina bifida, and they want to speak with another family about that, so we match those families together so they can, at least talk about the diagnosis together, what worked, what did not work. We also help them locate different services within the community. We work very closely with the care coordinators as well as the specialists. We can also attend IEP meetings for families, and we also work in the clinics. So if they have a question about a diagnosis or something that's been said to them in the clinic, we can help them get information about that so they can understand fully what the diagnosis is. Mainly, we are just support to each other during this time. We hire parents with lived experience, and so that's where we share with other families who can clinic our lived experience. I'm a parent of an adult child with a disability, so I share my journey with going through with my son with other parents who are just starting the process, and just help guide them through the process and understanding exactly that we're there to support them all the way through. And also they get a chance to join our parent advisory committee, where they will see other families, meet other families with different disabilities, and then they also form a bond to help them also understand things that are going on in school. What, if there's a particular food, like Amy mentioned about feeding clinic, different things that may help them, with their child, understand their child diagnosis, and just really being there for them. That's the most important thing that parent consultants can do, be there for them and also provide them with resources. I hope I answered that question. Do they offer scholarships to attend the conference? So they are very limited scholarships or stipends for the Family Voices Conference. So you can go on and apply and see if they have any monies left, because it was on first come, first served basis. You might also want to try the Alabama Council on Developmental Disability, the DD Council. They also have a consumer involvement fund that you can apply to also receive funds to attend those trainings, not just this training, but any trainings that might be beneficial to family members. The Consumer Involvement Fund is there for that. And Stacy has put that link into the chat, so you can click on that and hopefully you'll join us. You mentioned something like assistance for traveling to doctor's appointments. How can that be accessed to? I never heard about it, and my child has been a consumer for a long time.
So for individuals who have Medicaid as their coverage for medical expenses, Medicaid has a program called Medicaid Net, and Net stands for non-emergent transportation. So non-emergent transportation means, anything obviously outside of an emergency vehicle like an ambulance. So for local appointments or appointments in other cities, Medicaid will reimburse you mileage for those visits. If they are children's rehabilitation related visits, your care coordinator or the social worker or nurse in the clinic that you attend can submit those appointments for you. If they are appointments, they don't have to be CRS appointments that that you submit to Medicaid Net for mileage reimbursement. But if they are outside of a CRS related clinic, it would be the responsibility of the parent to submit those things, those appointments, dates and times. You have to submit them within 72 hours of the appointment. And if you look on the back of the Medicaid card, the card holder phone number that is listed there is the number that you call to access that program for submitting those appointments. It can be a lengthy process. You do have to go through several prompts to get to that portion. But when you hear non-emergent transportation, that would be the prompt that you selected in order to submit those appointments. Any medical appointments, so therapy appointments are included in that. For local visits, you get like $6 like flat rate for any appointments that are within the city that you live. And then outside of that, if you're going to a city that's outside of the city you live in, you will be reimbursed mileage to and from the appointment.
Okay.
There's a raised hand from Nancy.
Yes, regarding this, the other day, we request about this information, and they say they only for the child with Medicaid, they have other program, it's kind of like one child, that they make transportation for kids, the one place to other, whoever is the kid don't have Medicaid, they say the parents should, we ask about another cities like Birmingham, and they say as Birmingham, the parents should be paid $183. We was like, whoa. So is the child and children rehabilitation services, you say the parents should be informed 72 hours before? Is the kid don't have Medicaid and have Blue Cross Blue Shields, what they should be doing? Can you repeat please this?
So making sure I understood correctly, you're questioning the time frame that these appointments have to be. Okay, so if it's for a child within Children's Rehabilitation Service and your care coordinator is submitting that appointment information for you, that appointment has to be related to a CRS clinic.
Okay.
Okay, so for those appointments that are outside of those CRS clinic services, the family would then be responsible for submitting those appointments to Medicaid for reimbursement. Okay. That has to be done within 72 hours of the appointment.
If they have Medicaid, if they have Blue Cross Blue Shield, also they need to Children Rehabilitation Services?
As long as they have Medicaid, they can submit for reimbursement to the appointments through Medicaid. The Blue Cross Blue Shield does not negate being able to submit for reimbursement.
If you don't mind, can you provide this information to Miss Maria so we can have this in writing, please?
Well, that is through Medicaid. I can share with Maria from Medicaid's website the Medicaid Net documents that they have on there. and so that you guys can have those for review.
Thank you. And another question I have is, Mrs. Ingram say they have certain conditions you guys don't attend. But what happened with the child have some condition that you guys attend and others don't attend? You guys attend the child or you guys decide don't attend at all?
I'm sorry.
I'm
Nancy.
sorry, Maria, will you clear, or Ms. Nancy, will you clarify that question again for me?
Yes, Mrs. The person present, Mrs. Moore, when she present, she talking about some condition like communication disorder, hearing loss, seizures, cliff leaf, traumatic brain injury. But what happened when the child have one of these conditions, but in addition, one condition that you guys don't treat? You guys attend the child, or you guys decide don't attend at all? So what you guys doing in this case?
So just to clarify, Ms. Nancy, you were asking if the child has a qualifying diagnosis, but also has a non-qualifying diagnosis, what do we do?
Yes.
We serve
Yes.
the child. We serve the child and the family as long as they have that qualifying diagnosis. And the family wants the services that are available for that diagnosis. We will provide those services to that child and that family. The non-qualifying diagnosis, we just won't be able to provide any direct services for that. Outside of care coordination and resource connection and different things of that nature.
Christy and Amy and Vonda, I guess this is a question that I see that a lot of parents have been kind of send it to me. And I guess it has to be related to, for example, some of the children that might have a communication disorder, like expressive receptive disorder, but also has the autism disorders. Can they be still served under speech? And can they be joined and be part of CRS? Regardless of the autism.
Yes.
That's probably what it is.
Okay, I got you. Yes, so those communication disorders are what is the qualifying piece that's able to be billed. So that can be attached to any diagnosis. It can obviously be attached to autism. It can be attached to cerebral palsy. It can be attached to individuals who deal with seizures. So those pieces are what is required, are the required diagnoses to be evaluated in that augmentative communication clinic.
Okay.
Thank you.
And there were other questions, Vonda. Do you see them?
Yes. I want some more information about the income requirement. We can certainly send that to Miss Maria.
Well, I can speak to that. So income levels do not, regardless of your income level, if you have a qualifying diagnosis, you can enroll for CRS services. You can attend CRS clinics regardless of your income level. Your income level does not designate whether or not you are able to receive services through children's rehabilitation services. We do operate off of the federal poverty guidelines. And if your child comes through a CRS clinic and there is an item that is recommended to be purchased out of a CRS clinic, that is where your income comes into play. And if you fall outside of the 200% level of the federal poverty guidelines, then we are unable to purchase that item for you if your insurance does not cover it. But as far as receiving services through CRS, your income is not, or excuse me, enrolling into CRS, your income does not, is not taken into account.
Okay. This leads to the next question. Is there an income requirement to be eligible for CRS?
No, there is not.
Answer that. So, for example, my child has problems with only eating less than 10 kinds of foods, but also has an autism diagnosis. Can he become a client of CRS?
Sounds like he would be a perfect client to be seen through the feeding clinic.
Okay. there a limitation on insurance cover? Is this limitation considered too in CRS services?
So we can bill for any of the services that insurance allows us to bill for. But that's where your income guidelines would come into play. If you fall outside, for example, let's go back to our augmentative communication clinic and the high-end devices or devices in general that are typically recommended out of that clinic. For some Blue Cross policies and other private insurances, your insurance will only cover a specific amount. Since autism is not a billable diagnosis, and it's not a qualifying diagnosis for purchased services, if your insurance does not cover the full amount of that device, the family would then be responsible for coverage of the remaining piece of that device or remaining portion of the cost of that device. If you fall outside of the income guidelines, but you have a qualifying diagnosis, if your income is more than 200% of the federal poverty level, CRS cannot cover what the insurance does not cover. So to receive the evaluation services, there are no income limits. But for the things that may be ordered from those clinic evaluations, income can play a part depending on where you fall within those federal poverty guidelines.
Okay. If your child can't be a consumer, can the parents reach out to the parent consultants with questions? Yes. You do not have to be enrolled in CRS for the parent consultants to assist you. Dr. Hill and Miss Maria, can you invite them so that they can present about the transition clinic? We'll be more than happy to come back to do that.
Certainly, we will invite them again. This has been a great presentation, as you could see all the questions.
Yeah, and they're still coming. I would like to request an evaluation to see if my child qualifies to receive a communication tablet. Is it true that in order for my daughter to be eligible for evaluation, she has to have skills using a communication device?
No, that is a question that is asked on the intake questionnaire for the augmentative communication clinic. The different skills that your child may or may not have will, of course, directly affect the clinic evaluation process. We do like to see that there be a basis of some sort of speech therapy, whether that's through early intervention, whether that's through the school system, or whether that's private-based therapy, because if they've never been through a speech therapy evaluation or treatment plan, then we're not certain if a communication device is going to be most appropriate because we've not tried all the avenues that are available. So we do like to have that foundation of a previous speech therapy intervention attempt prior to bringing those kids through the augmentative communication. But you don't have to be able to use a device, a tablet style device, in order to, as a requirement. You don't have to have that requirement to be evaluated through the clinic.
Okay. Miss Maria, she flyers about your agency for Zoom meetings, but my child is not eligible to be a consumer. Can I still participate? And do you offer Spanish interpretation during those trainings if required? If you would like to attend one of the sessions that the parent consultants host, the Family Connection series, or be a part of our family our pack, if we know ahead of time, we can make arrangements about interpretation. And Dr. Hill has put a YouTube channel link there for a survey, and thank you so much. Sarah says something in Spanish, not sure what that is. Until what age did you say CRS provides services, and what happens after? CRS provides services from birth to 21 unless they have hemophilia, and then it's for a lifetime. And at 14, the kids begin to transition to work with vocational rehab along with the CRS transition specialist. So, Christine, you want to add something else to that?
So that's where your transition caseloads come into play. We began discussing transition and what that looks like from a medical standpoint, as well as a home and community standpoint, anywhere between the ages of 12 and 14. And from that point, until the child or the youth is 21 years old, we continue those conversations and we work with the family and the individual to help prepare them for what life is going to look like after they leave high school. Some children or some youths remain in high school until their 21st birthday. So the conversations will vary based off of the needs of the individual and the families that we're serving. For those individuals who their abilities will allow them to enter into the workforce, we look at those teen transition clinics and go through those vocational evaluations. Those vocational evaluations look at a myriad of different things. They look at strengths of the client, the ability level of the client, things that the client's good at, but also things that they enjoy doing. We don't, if we all had a choice of being able to choose a job that we loved over a job that we weren't so crazy about, we would 9 times out of 10 choose the job that we would enjoy doing. And so we want to make sure that we present those options that those youth will enjoy doing, but that they're also able to do as paths to venture down for careers. And then through that vocational evaluation and the Teen Transition Clinic program, we're able to make connections with the other divisions under the Department of Rehabilitation Services, such as Vocational Rehabilitation and the State of Alabama Independent Living Program, to determine if those other divisions are able to provide services. It is important to note that that CRS, Children's Rehab Services, is the only medical model within the agency of Alabama Department of Rehabilitation Services. Vocational Rehabilitation and the State of Alabama Independent Living Program do not focus on the medical needs and aspects the way that Children's Rehabilitation does. Vocational is going to make sure that individuals are placed in employment settings where employment is the goal, and they are going to focus on that aspect of it. And then independent living is going to focus on those needs where increasing independence is the primary goal.
Okay, Maria, we have 6 more questions. So you want me to continue?
Yes, please. If it is okay with you, the ones that were written in Spanish, I translated them. And so they are right there for you to see. Thank you.
Okay. All right. Is there a registration link to see if your child is eligible to begin the process, or how can I start?
So we do not have online enrollments at this time. So the best way to figure out if your child qualifies for services based off of diagnosis would be to contact your local office and speak to an intake worker who can talk that through with you to determine if eligibility is there based off of diagnosis. And again, I will make sure that Maria gets the list of offices around the state and the counties that are served through those offices with the contact information so that you can access that.
Okay, what is your website for your agency? Ms. Stacy, will you put that into the chat, please?
I certainly will.
All right, thank you. So my insurance plan provides only 40 therapies per 1 year from Blue Cross Blue Shield. Then CRS services will be included in those 40 times, or is it depending on the child's need?
So there are a couple of different factors that play in there. If your insurance company is only covering 40 visits, 40 therapy visits throughout the year. Those 40 visits will be billed to your insurance first. In order for Children's Rehabilitation Service to pick up any remaining visits that the child may need, therapy notes will have to be reviewed by the therapist. So if your child's in speech therapy, our speech therapist will have to review the treatment notes from the private therapy provider. That therapy that they are receiving will have to have been ordered out of a CRS clinic. We cannot pay for therapy services that are not ordered out of a clinic. So that includes physical therapy, occupational therapy, speech and language pathology. All of those things have to be ordered out of a clinic in order for CRS to pay for them. Also, in order for CRS to pay for any other visits, so it has to be ordered out of a clinic. If you've passed your 40 that your insurance will cover, our therapist has to review the treatment notes in order to determine a need to continue forth with further visits. But you also have to be financially eligible based off of the federal poverty guidelines in order for CRS to pick up any remaining fees. So that's where your financial information comes into play. You have to be below 200% of the federal poverty level in order for CRS to pick up any fees that insurance does not cover for any service.
Okay. A child has challenging behavior mitigation problems. In this case, can CRS connect to Blue Cross and Blue Shield of Alabama or a speech and language pathologist to work on this behavior issue?
So Connect Us would be one of the things that we can do for referrals. We would not make a direct referral to any mental health providers. Most of your Blue Cross, Blue Shield, they have care coordinators as well through that insurance provider. So you can also contact the customer service number and ask to speak to a care coordinator with Blue Cross Blue Shield as far as that goes. But any mental health services, behavioral services, or anything like that, your care coordinator can certainly provide you that information. But CRS does not address behavioral concerns as a primary. We don't deal with behavior or mental health concerns.
This question is by Sarah. What's the process to request an intake for my child? Is there a form to find online?
So there is no form, there are forms that are online, and they can be filled out and sent in, but the process is that you can contact the local office to speak with an intake worker, and they can provide you with their office intake days and hours. Offices are open Monday through Friday, 8 to 5, outside of any state holidays. We are closed on all state holidays. So anytime between 8 and 5, you are able to go to any CRS office and complete the enrollment process, which entails completing our intake forms. There's approximately 6 forms that have to be completed. And then the intake worker will also speak with the parent, caregiver, and youth, if available, to gather information to determine what areas within CRS that child can benefit from. So it can take anywhere from 45 minutes to an hour, maybe a little bit longer, depending on the worker, how much the worker likes to talk and how much the family likes to talk. It vary. But primarily you're gathering health and medical information, developmental information, discussing any concerns or needs that the family and the child have, completing intake forms, and gathering insurance information.
Hey, Kristen, I have a question just to clarify. I was reading this question again about the insurance providing 40 therapies a year through Blue Cross Blue Shield. And the question was, will CRS services be included in these 40 times? I think that question is asking, when we bill insurance for the clinic visit, we're not taking it's because we don't do therapy. We're not taking away one of those 40 therapy visits.
Correct. Yes, that is correct. We don't, because we bill for anything that may be from a therapist. It is not a direct therapy service like you would get at an outpatient therapy provider. So that does not take away from your 40 visits.
Thank you for clarifying that, Amy. And Ms. Vonda, I do not see any other questions, but oh my goodness, this has been a well of information, so much great information for our families. Thank you, Kristen and Amy and Ms. Vonda for presenting and for allowing our families to ask questions that are so relevant for them to continue making decisions about the care of their loved ones. Definitely, we are going to invite you again to come and present about Transition Clinic. What is it and what it looks like in the state of Alabama? And I will say thank you again for presenting. I will wait for you to send me that information so that for all the attendees, parents and professionals, I will send an email with the PowerPoints in a PDF format for you to review, to have access. Some of them have been translated. And I will send also the link that Kristen will send me with the local offices where you could find your local CRS office. And along with that, I will send the links for the YouTube channel where we are going to post this presentation if you want to review it later on. It's a good way for you to catch it up later on, maybe at night, you know, when you're about to fall asleep and see, okay, what else did they say? It's a good way for you to have access to review that information. Along with that, I will send, I'm gonna post right now the links for the survey. Please take a minute to fill out this survey so that they will go to the ACDD. You could pick it up. You could choose English, Spanish, or Korean surveys so that you could give some feedback about these presentations today, that it was from CRS and Help Me Grow Alabama. But this one will go directly under title. Make sure that you put CRS so that our grantee ACDD will know about the kind of, you know, if this presentation was helpful, you know, what else would you like to learn, you know? So please provide that information and that feedback to them. And let us know if there's anything else that you would like us to seek for a presenter in the state of Alabama so that we could make sure that we invite them over. So I do not see any other information, any other questions? Okay, so I'm posting them again, the surveys links. And if you do not see it on your device, don't worry. I will send an email with those links included as well. So Dr. Hill had to step out, but I'm gonna stop the recording right now.